So today we are going to talk about the kitchen herbs for ischemic heart disease, or commonly known as coronary artery disease. Now, in fact, the ischemic heart disease or coronary artery disease mean a problem with the blood supply of the heart muscle, primarily due to coronary artery atherosclerosis or blockage, which is usually due to the deposition of plaques in the lumen or the boundaries of the blood vessels that supply blood to the heart muscles, and therefore eventually they block, and this lead initial stage as angina, and subsequently they lead to heart attacks. So the lifestyle modification is necessary. The medicines are used, and we recommend continue to use those recommended by your health practitioner. And also, if the problem has been worse, people might need to go for surgical interventions or cardiac bypass. So we are going to talk about the kitchen herbs which can help to prevent the heart attacks and have potential health benefits, and these are known scientifically. So we are going to talk about those which have a proven mechanism of action. So the first one we're going to talk about garlic, or Allium sativum. So garlic is believed to offer multiple cardiovascular benefits. It can help lower the LDL cholesterol, it can reduce blood pressure, it can increase platelet aggregation, which means it can help the clot formation, and garlic stop the platelet aggregation and therefore prevent the clot formation. And garlic also help to improve the endothelial function, which is the lining of the blood vessels that are supplying the heart. Now, allicin is a sulfur containing compound in garlic, and that is thought to be the primarily responsible compound for these beneficial effects of garlic for the coronary artery disease, or heart conditions, or angina. The second herb we are going to talk today is green tea, or Camellia sinensis. The mechanism of action of green tea is the catechins or catechins in the green tea, especially the epigalactocatechin galeate, or EGCG, and that has antioxidant property that prevent the oxidation of the LDL cholesterol, and this is the key step in the development of the atherosclerosis. So green tea may also improve the endothelial function and inhibit the platelet aggregation or platelet clumping or clot formation, and therefore keep the lumen all blood flowing all the way through, and thus reduce the angina and the heart attack. The third useful drug is, in fact, kitchen herb, although it is sold in market in form of capsules by many companies, but you can use as kitchen herb, called turmeric or curcuma longa. And curcumin is the active ingredient in turmeric, and that has anti-inflammatory and antioxidant properties. It might prevent the oxidation of cholesterol and reduce the progression of the atherosclerosis and improve the vascular endothelial function. The fourth herb we are going to talk today is hawthorn, or Crataegus sep. So hawthorn is traditionally used for various heart conditions. Now it contains antioxidants that can prevent the oxidation of LDL, or low density cholesterol, and that improves the coronary artery blood flow. So hawthorn might also increase the heart muscles contraction, and that improve the overall function of the heart. The fifth herb today, the kitchen herb, is flaxseed, or Linum eucalyptaceae, mum. So this is a bit complex word, but flaxseed is commonly used name, and flaxseed is rich in the alpha linolenic acid, and this is a type of omega-3 fatty acid, and this also has lignans. So flaxseed, because of the alpha linolenic acid and lignans, have anti-inflammatory effect, and this is thus beneficial in preventing the atherosclerosis, which is responsible for the coronary artery disease or angina. Now flaxseed can also reduce blood pressure and also reduce the cholesterol, which are both directly or indirectly responsible for the heart attacks. So ginger is the other kitchen herb, also known as gingiber officinale, and it has anti-inflammatory and antioxidative properties. It might inhibit the LDL oxidation, it reduces the blood clotting by inhibiting the platelet aggregation, and it provides a mild reduction in the blood pressure, and all of these are helpful in preventing the coronary artery disease and the angina. So next or seventh herb in the track is basil or Ocimum basilicum or Ocimum basiliscum as it is called, but the active compound for mechanism of action is eugenol, and this can block the calcium channels and lead to vasodilatation and potentially reducing the blood pressure, and all of these effects are known scientifically to prevent the heart disease, particularly the coronary heart disease. So this also has the antioxidant properties, and that can reduce the oxidative stress, and that is beneficial for the heart health. The other kitchen herb we are going to mention today is rosemary or Rosmarinus officinalis. So mechanism of action of rosemary in the coronary artery disease is due to the antioxidant effect of the rosmarinic acid and carnosic acid, which can reduce the oxidative stress and inhibit the LDL oxidation. This helps to prevent the atherosclerotic plaque development, which is responsible for the coronary artery disease. The ninth herb for today's discussion is oregano or Origanum vulgare. So Origanum vulgare or oregano is rich in antioxidant. So oregano can prevent LDS oxidation and also has anti-inflammatory properties which help reducing the risk of atherosclerosis. So 10th or last herb for today is fenugreek, and fenugreek is also called Trigonella phoegnum gracinum, and these fenugreek seeds are commonly used in kitchen, and they contain soluble fibers which help to reduce the absorption of cholesterol from the intestine, and its saponins can also bind cholesterol and bind the salts and thus prevent their excretion, and thus reducing the cholesterol levels in the blood, and therefore it reduces the cholesterol levels by reducing the cholesterol absorption, and that is indirectly responsible for the coronary artery disease. It's important to note that these herbs may offer potential heart health benefits. They should be used as complementary and not as primary treatment for ischemic heart disease. Before starting any herbal supplement or making a significant dietary change, always consult with a cardiologist or your healthcare provider to ensure safety, and particularly taking the medications for heart conditions so that you are safe and you are getting the maximum benefit.